So as we already talked about the overview of Meniere's disease, and then we talked about the clinical features and how it presents. The next step we will now move on to is how we diagnose Meniere's disease, what are the different tests performed for diagnosis, and how we stage, at what stage the patient is, and how it can be managed. So the topics to be covered will be examination, how we examine, investigate, and then what are some special audiometry tests for the Meniere's disease. So diagnosis, we divided our diagnosis into different steps. First is the certain step is histopathology. It's certain how if Meniere's disease is present or not is the histopathology, in which we can find out the abnormalities in the tissues, cells, and under microscopic appearance. So histopathology. Histo is the word used for study of tissues, and then pathology is what are the different abnormalities present in the tissue. So histopathology. Then we have definite diagnosis is done by audiometrically documented hearing loss, and then tinnitus or oral fullness. So definite, if there is tinnitus present and there is fullness in the ear, and then it's audiometrically documented hearing loss. Audiometrically tests are performed, and that tells the hearing loss. That's under the definite diagnosis of Meniere's disease. Then probable diagnosis. Probable diagnosis is when there is episode of vertigo, audiometrically documenting hearing loss, and tinnitus or oral fullness present is probably maybe Meniere's disease, because the symptoms, and we said about the Meniere's disease, is tinnitus, vertigo, and fullness. When three things are present, the first thing that comes to the mind that patient might have Meniere's disease, and further audiometrically testing can make the diagnosis easier. Then possible causes of diagnosis include episodic vertigo without documented hearing loss and sensory neural hearing loss. That is possible diagnosis of Meniere's disease. So certain histopathology, definite further we have tinnitus and fullness and audiometrically documenting hearing loss. Then we have episodes of vertigo, tinnitus, oral fullness. So these are some steps that leads us to the diagnosis of Meniere's disease. Then examination of the patient, which is otoscopy. Auto is ear, scopy is examination or visualization. So examination or otoscopy. No abnormality in tympanic membrane. Mainly Meniere's disease is the disease that affects the inner ear or endolymphatic system. So tympanic membrane, where the external auditory canal ends and the middle ear begins, that's usually no abnormality is present in the tympanic membrane. Nystagmus is a quick component of nystagmus is towards the unaffected ear. So on examination of patient with Meniere's disease, if nystagmus is involuntary movement of the eyeball. It has fast component and slow component. The fast component of nystagmus is towards the unaffected ear. If suppose right ear is affected, right ear has Meniere's disease, the fast component will be towards the left side, which is the unaffected ear. Then the tuning fork test indicate the sensory neural hearing loss. The two main type of tuning fork tests are used. One is the Rainey's test and then the Weber's test, which tells us which side the affected ear is involved, which ear is involved, and whether it is conductive or sensory neural hearing loss. So these are the test or the perform to diagnose the Meniere's disease. If you see, this is the diagram that shows the nystagmus fast component towards the unaffected side. Then we have the otoscopy. This is the mastoid antrum, middle ear cavity, auditory tube, and nasopharynx. This is all, and these are the air conduction and bone conduction. This is the picture that shows the Rainey's test, in which the difference between bone conduction and air conduction is performed. Normally the air conduction should be more, but if it is bone conduction is more, it means it is sensory neural hearing loss. But if there is air conduction is obstructed or less, it means it's the conductive hearing loss. So these are the different tests performed for the examination of the Meniere's disease. Then staging of the Meniere's disease, the stage, we have 1, 2, 3, 4, and pure tone average in decibel in previous 6 months. So this is the test for this previous average in these last 6 months. So first stage, the pure tone is usually less than 25 or equal to 25. Then in stage 2 is 26 to 40, stage 3 41 to 70, and in stage 4 it is more than 70 decibels. So this is the Meniere's disease. Stage 1 is more serious because it's less 25. This is the stage 1. So first this is 25, less than or equal. Then we have 26 to 40, 41 to 70, and then it's more than 70. So it keeps on getting worse and worse. That's how it progresses. And it tells us the pure tone average in decibel over the previous 6 months. Investigations, special investigations include pure tone audiometry, sensory neural hearing loss, and then we have speech audiometry. Discrimination ability is impaired in this Meniere's disease. And then we have special audiometry test, which is in which we do the recruitment test is positive. Short increment sensitivity index test, and then tone decay test. Usually these are all the tests performed, and then pure tone audiometry tells us that the hearing loss in the Meniere's disease is sensory neural. And then there is discrimination ability. When different speech is performed and ask the patient to tell or repeat the speech or repeat the words, usually discrimination is impaired. And then recruitment test is positive, and then we also perform tone decay test. The tone is decaying in the Meniere's disease also. So these are some special investigations performed for the Meniere's disease. Electrocochleography, in which electrocochleography, as the name shows, electricity or electric current is applied, and then it shows the graphing or recording of the response of the cochlea in response to the electric current, and this gave us the summation potential and action potential ratio, which is greater than 30%. Caloric test reveals a canal paresis on the affected side. And then we have glycerol test, which is the audiogram and speech discrimination scores are recorded before and 1 to 2 hours after ingestion of glycerol, diagnostic and prognostic value. So all these are the different tests which are special tests. We have pure tone audiometry, speech discrimination, caloric test, electrocochleography, and glycerol test, in which test is performed before and 1 to 2 hours after ingestion of glycerol, and then it's also have diagnostic and prognostic value, and we find out what are the findings before and after. So all this these tests, diagnosis and examinations are performed for the diagnosis of Meniere's disease. Now, special audiometry tests, what are the differences between the different special audiometry tests? We have this test is, these tests are mainly performed to differentiate between cochlear lesions from the retrocochlear lesions and how the normal patient will present. So first is pure tone audiogram. Pure tone audiogram, normal in normal patients. In cochlear lesion, patient will present with sensory neural hearing loss, and in retrocochlear also sensory neural hearing loss. Speech discrimination score in normal is 90 to 100%, should be perfect, about 90 to 100%, maybe little mistakes, but in cochlear lesion it's below 90%, and in retrocochlear lesion it's very poor. In retrocochlear lesion, mainly the 8th cranial nerve, vestibulocochlear nerve is involved, so it is very, very poor. Then rollover phenomenon, absent in normal, absent in cochlear lesion, and it is present in retrocochlear lesion. SI score, it is 0 to 15% in normal patient, over 70 in cochlear lesion, and 0 to 20% in retrocochlear lesion. Threshold tone decay test, 0 to 15 decibel in normal, less than 25 decibel in cochlear, and above 25 in retrocochlear lesion. Stapedial reflux, also known as acoustic reflux, it's present in normal patient, present in cochlear lesion, and it is absent in retrocochlear lesion. Stapedial reflux decay, normal in normal patients. Cochlear lesion, it is also normal, and it is abnormal in retrocochlear lesion. Bera is basically oral cerebral region activity. So normal interval between wave 1 and 5, normal between 1 and 5, and in the retrocochlear, wave 5 is delayed or absent. So these are the main differences if you see if the patient is normal, and to find out whether the abnormality or lesion is cochlear or it is retrocochlear. These are the difference. We can do the different special tests and find out if the differences are present or not. That was all about the different tests and investigations. We talked about the different tests, even special tests performed to diagnose Meniere's disease. So thank you for watching sqadia.com.